Hi ladies, for this week's 2-minute tips, we are talking about coccyx pain or tailbone pain. This applies to any woman that is feeling this during pregnancy or after birth. It's common in both scenarios. So I'm going to give you my 5 tips to help manage this pain a little bit better. Tip number 1 is to limit the amount of time you spend in sitting. So these days in a Western society, we sit to eat our breakfast, we sit to drive to work, we sit all day at a desk at work, we sit to drive home, we sit to eat our dinner, and then we lie down and go to bed. And that is a lot of time spent in sitting. Now we know that sitting is often the number 1 aggravating issue for coccyx pain because we're sitting directly on that tailbone. So if you can limit the amount of time spent in sitting, that makes a huge difference. So that may look like getting a standing desk so that you can switch between standing and sitting. It may look like taking regular walking breaks to the toilet and back or up the corridor and back every hour. It may look like sitting on a Fitball or standing up to eat your lunch or going for a walking meeting, those sorts of things. Anywhere where you can change sitting to a standing or even a lying down movement can make a world of difference. So even if you're watching TV or reading a book at night time, instead of sitting on your coccyx, try lying down instead because that will take the pressure off. So number 1, limit the amount of time in sitting. Now, number 2 is to change your sitting environments. Obviously, we can't not sit during the day. That's not how our society is built. So can you try when you're sitting to sit in what we call a bit more of an anterior tilt? So when you're tucked back and a bit slouched, you're putting more pressure on your coccyx and that will often aggravate it. Whereas when you lift your pelvis up, anteriorly tilted a little bit, that will take a little bit of pressure off. So you can do this by putting a rolled up towel in the small of your back, so that helps you to sit a little bit more upright. You can also do this by sitting on a Fitball, which generally promotes you to be a little bit taller rather than slouching back. Or you could try sitting on a softer surface, so putting a cushion or a coccyx specific donut or soft inflatable cushion underneath your chair. So you can change your sitting environment to make yourself feel more comfortable. Number 3 is to keep yourself strong and mobile through exercise. So outside of your sitting environment, keeping your glute muscles strong, keeping your core strong, keeping your pelvis strong through exercise. And if you're pregnant, specifically pregnancy specific and safe exercise is so important, because if you have a good, strong, functioning muscular system, that's going to allow your coccyx to take a little bit of the load off it. Whereas if you're really weak and deconditioned around the middle, you're going to put more pressure on your coccyx bone. That's going to take more of the load. So if you can keep yourself strong and conditioned through regular exercise, that is very important. Number 4, relax your pelvic floor. So your pelvic floor does actually connect to your tailbone. So it physically attaches to your tailbone. Now, if your pelvic floor is overactive, it's tight, it's under tension, and it's switched on for longer than it needs to be during the day, i.e. you're not relaxing it properly, that's going to be pulling and stressing on an already bruised and sore coccyx. So it's really important that you learn to relax your pelvic floor properly. So check in with yourself regularly throughout the day and think, am I switched on right now? Can I let go of my pelvic floor? If you can't, try and let go of your tummy first. So do some big belly breathing and see if you can let go of your pelvic floor by letting go of your tummy first. And number 5 is go and see a pelvic floor physio. So this is definitely something that we deal with all the time. If you've tried the steps above and you're still suffering, it is not normal. It is not something you have to put up with. Go and see your local pelvic floor physio. They will definitely help you out. So I hope that was helpful. I'll catch you all next week for 2-minute tips.